The first time HIV came into my presence, um, I went to give blood in, I think, 82, and they had a series of questions. And they were, have you had sex with one or more gay men in the last 4 years? And I had to admit that I had had at least one experience, and they said, do not give blood. And I had a doctor in the village. As it was evolving, and we really didn't know what it was. It was at the grid area, maybe at the gay cancer area. We had no idea of spread. And I would go into his office, and you would sit and you'd look. What is that? Does he have it? Does he have it? Do I have it? Diagnostic criteria in those days were very loose. If you had palpable lymph nodes in your groin or under your arms, that was enough to indicate you might be infected. There was no test. And he was very sweet in that he said, I think that to protect yourself and protect your sexual partners, you might start using condoms. So before that, gay men didn't use condoms. They were to prevent babies. They were not to prevent STDs. I got tested in 1986 or 7. And at that point, I was told the likelihood that I would die in 10 years, which was the case for many people. And for whatever reason, I just decided, well, that may be what the statistics are, but that's not me. I'm going to be okay. And in fact, I was. And the last time I had a detectable viral load was in 1995 when I got on a clinical trial of an experimental protease inhibitor. The first drug that came on the market was AZT. In the doses that we gave, it was toxic. We used about half the dose that we used in those early days. We had the era of the one drug combo. So it wasn't a combo, it was a single drug. And we soon learned that you develop resistance and the drug was no longer effective in a matter of months. And so you had serial monotherapy. You'd go one drug, you take another drug. And then people started combining drugs, so there was a 2-drug era, but that did not last long either. People quickly developed resistance. So it wasn't until we had 3 drugs available from at least 2 classes that we could treat HIV starting in the mid-90s. That was probably the most crushing period for many of us in HIV because we had patients who we knew we could control their virus, but they were too advanced to take advantage of the medications. So from 95, 96, 97, 98, people were still dying. I was a full-time nurse on the day shift at Cedars-Sinai on the HIV unit. It was a 31-bed unit. We had our own social worker. We had our own dietitian. We had our own case manager. We had our own pharmacist. We had services to the level that nobody else did. It attracted a particular kind of nurse. So a lot of people had a lot of AIDS phobia in those days. We would deal with that head on, but some people, so they were floating a nurse for the day and they would walk into the unit to find out what it is and they'd walk right out. Even though we were losing 4 or 5 patients a week, because that was the care then. We didn't have treatment. We could treat opportunistic infections for a short period of time. We'd spiff people up in the hospital, send them home, they'd come back 3 months later. So it led us to develop really strong relationships with our patients. Strong bond, sort of being in the trenches with each other. And we held each other to the very highest nursing standard. And it was in that crucible of nursing that I learned how to be a nurse. We never let anyone die alone. We dealt with a lot of messy social situations. And we gave extraordinary nursing care. We'd have people from film industry. We'd have designers, so when they came into the hospital, they would come in with curtains and rugs and furniture, and we let them be themselves. So if a couple wanted to have some private time, we would shut the door and give them a half an hour or an hour. There are some patients that resonate with you more, and I remember, I'm not sure what he did. His name was David, and he was quite flamboyant. And he and a volunteer were playing around with her earrings, and he put her earrings on, and they were fabulous big earrings, typical that a gay man would be thrilled to wear. And they were playing. She turned around and walked out. As she got to the door, he had pulmonary KS, and he started choking, and a little blood came out, and he was choking. What was actually happening, his lungs were filling with blood. He had eroded into his pulmonary artery. And you'd think he was drowning in his own blood. And within a minute, he died. I became extremely good at helping patients at the end of their lives. I don't know where that came from. Before I was a nurse, I never saw anyone die, and I probably have been with 300 patients who've died at this point. And I've always found great honor in that. We all talk about Mr. Kim. So Mr. Kim, I'm not sure how he was infected, but he was, and he died, and he was married, and because he didn't die in his own house, after he was cremated, he could not be brought back to his house. So Mrs. Kim asked if we would hold his ashes. And I remember a social worker, and I said, where the heck are we going to put these ashes? I got to lock them up someplace. Got to keep them safe. They didn't fit our med drawer, but I found a cabinet. We locked them in. Then Mrs. Kim came up, and she took the urn and very ceremoniously wrapped it in a silk bandana or something. But wrapped it very ceremoniously, and she carried it, and she took him back to Korea to be buried. Buddhists will teach that, your entire life is preparation for the moment of your death, and that you should go into it with great anticipation because it's the next best thing. It's amazing when you're taking care of a dying patient, and you can see them. You might be as close as you and I are, or from across the room, but you can look at them, they're alive, you turn away, they die, and you look, and it's just with a nod of a head. And something has changed in their body. Something has left, the life force has left. I can't believe that that's not worth something in the universe. So I think there's something. Nobody has yet come back to tell us what it is. But I'm really a strong believer. I'm not terribly religious, I'm quite spiritual, and I really absolutely believe that there's something that's equally wonderful to this life. The way I released myself after somebody died, so in the early days, we had shrouds, and they were actual cloths. Now there's a Ziploc bag. But they were shrouds, and when somebody died, you tied their hands and put them in a neutral position, and you wrap them in a shroud. And it was a process that generally took 2 nurses. It was very much a cap to maybe years of care. And my way of getting around that was I would sing Happy Trails. Happy trails to you until we meet again. Happy trails to you, keep smiling until then. Happy trails to you till we meet again.